Community palliative rehabilitation is a vital yet often misunderstood aspect of care for people with advanced illnesses. Unlike hospital-based services, community palliative rehab brings physiotherapy and occupational therapy directly to patients in their homes or local centers. This approach aims to help individuals maintain function, independence, and quality of life, even as their conditions progress. However, there is currently no standardized guidance on how these services should be delivered in the community, leading to inconsistent care and unmet patient needs. In this video, we'll explore the latest evidence on what makes community palliative rehabilitation effective and how integrating key aspects can improve outcomes for patients and their families. One of the most significant findings is the value of early referral to community palliative rehabilitation. When patients are referred early, therapists can build trusting relationships with both patients and caregivers. This trust encourages open communication about symptoms, concerns, and goals, allowing therapists to tailor interventions more effectively. Early engagement also helps patients feel more comfortable and supported, which can lead to better identification of needs and improved outcomes. By starting rehabilitation sooner, patients are more likely to maintain independence and manage symptoms proactively, rather than waiting until challenges become overwhelming. Layered model of care is central to effective community palliative rehabilitation. In this approach, generalist therapists handle less complex cases, while specialists focus on patients with more challenging needs. This division allows for timely responses and ensures that specialist skills are used where they are most needed. Importantly, the model encourages collaboration between generalists and specialists, empowering all staff to deliver higher quality care. Support workers and volunteers can also play a role, delivering prescribed interventions under supervision. This structure not only optimizes resources but also ensures that patients receive the right level of care at the right time. Integration is a key factor in successful community palliative rehabilitation. Physiotherapy and occupational therapy should not operate in isolation. Instead, they need to be closely linked with primary care, specialist palliative care, and other community services. This integration allows for better communication, earlier and more appropriate referrals, and a more cohesive experience for patients. When all providers understand each other's roles and work together, patients benefit from a seamless continuum of care. Leadership representation for rehabilitation professionals further strengthens this integration, promoting a culture of empowerment and independence for patients. Holistic, patient-centered assessments are the backbone of effective community palliative rehabilitation. Therapists look beyond just physical symptoms, considering psychological, social, and spiritual needs as well. By understanding the whole person, therapists can tailor interventions to what truly matters to each patient. This approach empowers patients to set meaningful goals, improves satisfaction, and encourages active engagement in their care. Holistic assessments also help patients reframe expectations, build resilience, and manage their own health more effectively, even as their conditions change. Flexibility and accessibility are essential for meeting the diverse needs of palliative patients. Services should be available in various settings, including patients' homes, outpatient clinics, and community centers. Offering both group and one-on-one sessions allows patients to choose what works best for them. Virtual and hybrid models can help overcome geographic barriers, making it easier for patients to access care. However, it's important to ensure that technology does not create new barriers for those less comfortable with digital tools. Ultimately, flexible service delivery ensures that rehabilitation is available throughout the patient's journey, regardless of changing needs or circumstances. Providing timely, accessible information and education is crucial for both patients and their caregivers. Early in the palliative journey, information about symptom management, available services, and what to expect can reduce anxiety and empower patients to take control. Ongoing education helps patients and carers understand interventions, set realistic expectations, and build confidence in managing challenges. This support is especially important for caregivers who often play a central role in daily care. Well-informed patients and carers are more likely to engage with rehabilitation and experience better outcomes. Despite progress, there are still gaps in access to community palliative rehabilitation, especially for marginalized groups. People from racialized communities, those living in poverty, rural areas, or with limited education may face additional barriers. Services must be designed to actively reach and support these populations, ensuring equity in care. This may involve offering more personalized support, addressing language and cultural differences, and providing extra guidance for those unfamiliar with healthcare systems. Addressing these gaps is essential for delivering truly inclusive and effective palliative rehabilitation. Integrating these 5 key aspects, early referral, layered care, holistic assessment, flexible delivery, and comprehensive education, can transform community palliative rehabilitation. Policymakers and service providers should use these principles to evaluate and improve existing services. Ongoing research is needed to address gaps, especially around access for marginalized communities and support for caregivers. By focusing on patient-centered, integrated, and adaptable care, we can ensure that all palliative patients receive the therapy and support they need to live as fully as possible.